Hi. About 10 months ago, I learned that I have an elevated lipoprotein A. This came as a bit of a shock to me, and I'll be honest, I really did not know much about it until then. I actually found my level was high through participation in a research study, and I never expected the result to come back high as it did. But when it did, I started digging, and the more I learned, the more concerned I became. Lipoprotein A, sometimes called LP little a, is a genetically inherited cholesterol particle that significantly increases the risk for heart disease, stroke, and aortic valve disease. It is similar to LDL cholesterol or bad cholesterol in structure, but with an added protein that makes it even more likely to promote plaque buildup and blood clotting. The trouble is, it does not show up in a standard cholesterol panel, and most people have no idea that their level is elevated. And many do not find out until it is too late and heart damage has already been done. As I explored what this meant for my cardiovascular risk and what I could actually do about it, I realized that this information needed to be more widely shared. There's definitely a serious gap between what science is uncovering about lipoprotein A and cardiovascular risk and what patients are actually being told. So I created a video to walk through what I had discovered. And the response to that video was overwhelming. Thousands of people have watched, commented, and shared their own stories. Many had just recently learned about their own lipoprotein A, and some have never even heard of it before. Since then, I have been on a mission to learn as much as I can about lipoprotein A, not only for myself, but so that I could share it with others on this channel. So when I learned about a virtual conference dedicated to lipoprotein A, I jumped at the chance to attend, even if it was at 5 p.m. on a Friday, because I wanted to learn more for myself and also because I thought it would be a great opportunity to take this information being presented by the real experts to doctors and other healthcare professionals, and then take that and translate it for the average person. I'm Valerie, a registered nurse and health educator. My goal on this channel is to bridge the gap between what the most recent science tells us and what information actually makes it to patients. There was a big lag in getting new information like this to doctors. I know I wish my doctors were at this conference. And then there was another gap between getting that information to the patients that the doctors care for. So in this video, I want to bring you some of the most important insights from this Lipoprotein A conference. I'll be talking about what the experts are now trying to teach doctors, what patients still are not being told, and what you can do to better understand and manage your risk. One of the first things addressed at this conference was that most doctors, even including cardiologists, still do not understand lipoprotein A very well. This was acknowledged by the expert presenters right at the very start. And that has been what I have observed in my own experience too. After I got my test results and started asking questions, I found that most of my healthcare providers were not very familiar with lipoprotein A or didn't think it was really worth paying attention to. They really did try to dismiss it, and I had to push for additional testing because I had some symptoms that, learning when I had a elevated lipoprotein A, it brought a new concern to those symptoms. So just a brief side note for those who have been following along all along. About a year after these symptoms started, I now know that they're likely due to a low ferritin level. And it seems doctors don't know much about that either. But that is a topic for another video. So back to lipoprotein A, which is a serious, well-documented risk factor for heart disease, stroke, and aortic valve disease. And it is estimated that about 1 in 5 people have elevated levels. That is a large percentage of the population. Yet most people don't know whether or not they are affected because it is not included in routine lipid testing, and most doctors do not know to test for it. That is why education is so important. The goal of this conference was to start bringing more awareness and understanding about lipoprotein A so that more healthcare providers begin ordering the test, recognizing the risk, and talking to their patients about it. This is the kind of shift that takes time, but it has to start somewhere. And I think it is also important for patients to be a part of that shift. When I found out that my level was high, it motivated me to take action. I started learning more, I asked for additional testing, and I made some meaningful changes to my lifestyle over the past year. And I've heard from so many of you who have done the same. But none of that can happen if people do not even know what lipoprotein is or why it matters. So while this conference was directed at doctors, I think that patients deserve access to this information just as much. So that is why I am sharing it here. One of the major themes of this conference was just how complex lipoprotein is and how it deserves as much attention as, if not more attention than, other cardiovascular risk factors. The presenters emphasized that lipoprotein A is primarily determined by genetics. Your level is mostly set at birth and stays relatively stable throughout your life. However, they did highlight a few important situations where levels can change. So one example of this, and I've not talked about this on my channel yet, but one example is menopause. Several studies have shown that lipoprotein A levels tend to increase after menopause. And this may partly explain why cardiovascular risk in women rises so significantly during that time. So if you're a woman who's gone through menopause and hasn't had your lipoprotein A checked, or even if you have had it checked prior to menopause, it might be worth bringing this up with your provider, especially if you have other risk factors. Another key point that came up that I want to mention because I've received a couple comments and questions about this is the relationship between ethnicity, race, and lipoprotein A levels. So it is true that median lipoprotein A levels vary among different racial and ethnic groups. For example, those of African ancestry tend to have higher median levels, while people of East Asian descent tend to have lower levels on average. But it was emphasized during this conference, and I also discovered this when I was sorting through the most current research, is that the risk associated with elevated lipoprotein A appears to be consistent across different racial groups, even if older research once said something different. In other words, if someone has a high lipoprotein A level, regardless of their race, their risk of cardiovascular events increases in a similar way. There was also a lot of discussion at this conference about growing international support for broader lipoprotein A screening. Several countries, including Canada and parts of Europe, now recommend that everyone be tested for lipoprotein A at least once in their lifetime. In some places, that testing begins in childhood, typically between the ages of 9 and 11, especially if there is a family history of cardiovascular disease. The United States is not quite yet there to the point of recommending routine testing in childhood or even in adulthood for the general population. But the guidelines are starting to shift. And they did mention that it will be discussed at the upcoming American Heart Association meeting. Besides that, organizations like the European Atherosclerosis Society, the Canadian Cardiovascular Society, and the National Lipid Association in the United States have all endorsed universal, once-in-a-lifetime lipoprotein A testing as a reasonable and proactive step. But for right now, in most clinical settings, lipoprotein A still is not being tested unless the patient or their provider knows to ask for it. In fact, they had a couple of polls during this conference. One was they asked who had been tested themselves, and the second was who routinely tested their patients. And not many people responded yes to either. I thought that was a great way to demonstrate this problem. Because as the experts at this conference pointed out, this test gives us meaningful information that we can't get from a standard lipid panel. And with a better picture of one's cardiovascular risk, lives, could be saved. One of the things that I've been reflecting on after this conference is if I need to be more proactive about lowering my LDL cholesterol. Now, to be clear, my LDL is not considered to be dangerously high. But with that elevated lipoprotein A, the current recommendation from several organizations is that LDL should be brought down to below 70 if possible, just like if someone has any other major risk factor. So this is challenging for me because my own doctors do not seem particularly concerned about this. Even when my LDL was high at 114, there was no discussion about treatment or getting that LDL below that 70 threshold. Really, they didn't even mention the result at all. I kind of left my last doctor's appointment surprised by this, especially since I was just there to discuss my lab results. But I do kind of understand why. And this is because of this lack of knowledge among doctors on how to act on lipoprotein A in clinical practice. But I was able to make a difference on my own, even if by accident. And since my last lipid panel, my LDL dropped by 14 points. Both my total cholesterol and my LDL is the lowest that I have ever seen it. They have always been a little bit high, which runs in my family. I've still been eating the same heart-healthy diet, but was worried that it might have gone up because I sprained my ankle a few months back, which means I haven't been quite as active and have put on a few pounds. The only thing that can explain the decrease is that I had started taking berberine. I didn't even start taking it for cholesterol. But when I saw the drop, I knew why, because I had already done some research for another video all about berberine on this channel. And there are studies showing that berberine can lower total cholesterol, LDL, and triglycerides, especially in people with mild to moderate elevations. So it does appear to have helped me. And I was a little disappointed during this conference when berberine was mentioned because it was kind of laughed off and called nonsense. There wasn't much interest in discussing the evidence behind supplements or integrative strategies, even though many patients are using them and trying to take a more active role in their health with them. And I do want to note here that both doctors presenting at this conference have financial ties to pharmaceutical companies, so that might explain that. But I do not think medications are bad, but I do not think that supplements with proven benefits should be brushed off. Now, I want to be clear. I am not recommending that everyone go out and start taking berberine. Supplements are not one size fits all, and they are not all safe or appropriate for everyone. And it is not a heavily regulated industry. In fact, when I was researching what berberine to take, several brands that were tested did not contain what they claimed to contain. But I do think it is worth looking into the available options, especially if you are trying to bring your LDL down and your care team isn't offering much beyond watch and wait. I am currently researching other supplements that may support healthier LDL levels, and I plan to do a full video on that in the coming months. But it is something that I want to approach carefully because not all of these supplements are harmless. And the goal here isn't just lowering numbers, it is lowering overall risk. It was made clear at the conference that there is currently no approved treatment specifically for lowering lipoprotein A. But there are a couple of medications in late stage development that could become available in the next couple of years. One is called pelacarsen, which works by targeting the genetic instructions used by the liver to make lipoprotein A. By blocking that signal, pelacarsen reduces the amount that's produced. Another is olpasiran, which interrupts the same process in a slightly different way. Both of these treatments have been shown in earlier trials to lower lipoprotein A by 80 to 90%, which is a significant drop. But what we do not know yet is if lowering lipoprotein A actually leads to fewer heart attacks, strokes, or other cardiovascular events. And that is the most important question. These medications are currently in phase 3 clinical trials. This is the stage where researchers look at real outcomes over time. So this is where we find out if by lowering lipoprotein A, we actually also lower cardiovascular risk. We should start seeing some data from these trials within the next year. And if the results are positive, medication approval could follow as early as 2026. But there still are a lot of unknowns, and nothing is available yet outside of these clinical studies. If you are interested in a deeper dive into these medications and how they work, I did a separate video on that topic called A New Hope for Heart Health, and I'll include a link to that video in the description for this one. There was also a brief mention of niacin at the conference, which I want to touch on because I have received several comments from viewers asking about it, and some even suggesting that I try it. Niacin, or vitamin B3, can lower lipoprotein A, in some cases by as much as 20 to 30%. One of the presenters mentioned that about a 23% reduction can be seen, which lines up with some of the older studies. But niacin is not currently recommended for lowering lipoprotein A, and that is because there is some debate as to if it increases cardiovascular risk in other ways. So in the case of LDL, which niacin has been used to lower, that has not consistently translated to reducing actual cardiovascular events. So this has become known as the niacin paradox, where the cholesterol numbers improve, but the outcomes don't necessarily get better. And beyond that, niacin can have side effects. So it can cause flushing, it can raise blood sugar, it affects liver function, and it can even promote inflammation in the blood vessels, which can contribute to cardiovascular disease. So while I do plan to continue researching niacin, based on what I have seen so far, it is not something that I am comfortable taking at this point. This shows that not all strategies that lower a number are helpful in real life. So until we have clearer answers on medications or targeted therapies, the best thing that we can do is to continue focus on improving overall cardiovascular health, because we do know that that works. Because even if we can't lower lipoprotein A directly, or even know if that will make a difference, we can still reduce overall cardiovascular risk. This includes managing LDL and triglycerides, blood pressure, blood sugar, inflammation, physical activity, diet, stress, and sleep. And those things have all been proven over and over again to reduce the chances of heart disease and stroke. So while it can be frustrating to know that there is this risk factor that we cannot fully treat yet, that does not mean that it is a dead end. And there is still a lot that we can do to stack the odds in our favor. Lipoprotein A is a major risk factor for cardiovascular disease. It is genetic, it's common, and it is still not well understood by many healthcare providers. But that is starting to change, and hopefully there will be more conferences like this so we can begin to see more of a shift. So what we now know and what you learned in this video is that elevated lipoprotein A increases the risk for heart attack, stroke, and aortic valve disease. We also know that most people with high levels do not know that they have it, and that is why screening matters. And while we wait on more clarity on medical treatment, there is still a lot that you can do. Because while you cannot change your genes or your lipoprotein A at present, you can influence how much impact that it has on your heart. And that power comes through lifestyle. Exercise, diet, sleep, stress management, and blood sugar control are all powerful evidence-based interventions that reduce inflammation, protect your arteries, and improve cardiovascular health in real, measurable ways. They don't just lower lab numbers, they help protect your heart and prevent cardiovascular events. And if you are not sure where to start, I have created a full playlist of videos all about heart health, from cholesterol to triglycerides to inflammation and lifestyle strategies. You can find that at the end of this video, and I will also link to it in the description. And I also want to take a moment to let you all know that I'm also in the process of launching a Patreon community. Patreon is a platform where creators can build a community and offer additional benefits to those who want to support their work. As of the time of this recording, I am still finalizing this setup, so I can't share all of the details just yet, but it will be ready by the time this video goes live, so I will put a link to learn more in the video description. The reason I am starting this community is pretty simple. Through my experience with lipoprotein A and other health challenges, I have seen how often patients are left to figure things out on their own. I had to research and advocate for myself because my doctors are not always up to date on the latest science or even the old science, as my recent discovery with ferritin taught me. My goal, well, actually, my dream, is to use my experience and education as a nurse and health educator to help others be stronger self advocates by becoming more informed, more confident, and more in control of their health. Supporting me through Patreon will help me dedicate more time to researching and creating videos like this on a wider range of health topics. And one of the membership levels will even give you the chance to suggest topics for future videos so that the content reflects what you truly want to know, not just what the YouTube algorithm favors. If you found this video helpful, please give it a like. It really helps this information reach more people. And if you would like to stay connected here on YouTube, please make sure to subscribe to this channel. I've got more videos on the way, including that one on LDL lowering supplements that I'm actively researching right now. My goal here on this channel is still to help you become more informed and more empowered to take control of your health and longevity. Thank you so much for watching, and as always, please take good care of yourself.